Let's briefly explain about cancer. Cancer is a disease in which a group of malicious cells, or cancer cells, multiply in the body. Normally, the body replaces old cells with new ones. But cancer disrupts this balance. There are actually many types of cancer, and the names changed depending on which organ or tissue it occurs in. For example, lung cancer starts in the lungs, and breast cancer starts in the breasts. There are many causes, and risks include smoking, UV exposure, genetics, unhealthy diet, and environmental influences. That's why health checks and cancer screenings are so important. There are various treatments for cancer. Treatment options include surgery, radiation therapy, chemotherapy, drug therapy, and immunotherapy, but the choice depends on the type and stage of cancer. Early detection and a healthy lifestyle are key to fighting cancer. You can reduce your risk by getting cancer screenings, quitting smoking, eating a balanced diet, and exercising. If you are diagnosed with cancer, there is hope because of medical advances and a support system. Next, let's explain in detail about cancer surgery. Cancer surgery is a medical procedure performed to remove cancer cells. The surgical method varies depending on the type of cancer, stage, progressiveness, and patient's health condition, and may include surgery, endoscopic surgery, resection, and tumor removal. Surgery is often suitable for treating cancer in its early stages and has a high success rate when the cancer is small and has not spread to surrounding tissue. However, surgery involves risks, and the appropriate treatment method is selected depending on the patient's general condition and age. The cost of surgery varies depending on the country, region, and insurance. Cancer treatment requires a comprehensive treatment plan, which can include not only surgery costs, but also radiation therapy, chemotherapy, drug therapy, hospital stays, doctor's fees, rehabilitation, and more. There are also ways to reduce the financial burden of cancer treatment. You may be able to receive financial support through medical insurance or public support systems. It is also important to manage the progress of medical expenses and create a budget. Ultimately, the cost of cancer surgery and treatment will depend on an individual's health insurance and financial situation. It is important to work together with your doctor and hospital staff and proceed with your treatment plan while receiving appropriate support.